Then we have group 3, the endometriosis group. If the person just has endometriosis, and usually women have endometriosis and they don't even know it, because it's actually a natural part of the 5 phases of the menstrual cycle. But if they don't stop having the endometriosis, then that's what the problem is. Unfortunately, if you go to a gynecologist at the time that you have endometriosis, they will treat you for endometriosis. But a few days later, you naturally may not have it anyway. But if you still have it 2 weeks later, then you have endometriosis. So don't take the gynecologist's opinion as true just because you've seen them once and they say you've got endometriosis. Go back 2 weeks later and have it checked again, because more than half the case, it's gone naturally. All right? So there's a lot of over-prescribing goes on in that area. If there's no other obvious interference with the endometrium, then just do general A. It's almost miraculous what it can do. The other thing is that you need to look at the person's diet. Take them off any foods that are aggravating them. All right? Now, usually that means processed or fried, anything that's basically not natural. Have them go onto a natural diet for a month, and that's usually enough to clear out the endometriosis. In fact, if you want to know more about it, ask Estefania, because she's studied the macrobiotic food processing and how to use that to clean out the system so endometriosis can't exist. So you can do it dietarily. You can add these points, so you've got these points and the diet, or you can use the points. But really the combination of the diet and the points is by far the most effective. And people who have had endometriosis for a long time have recovered from it using these points in literally days. The inflammation can be gone literally in 3 days. If they have endometriosis from fibroids, or even if they just have fibroids and no endometriosis, no inflammation or anything, then you can use this recipe of spleen 6, spleen 8, spleen 10 and bladder 17. If they have circulation problems generally, not only with their periods and stuff, but generally, you can use kidney 3 and kidney 7. Sometimes the endometriosis is there simply because they're not actually removing the old hormones, and the hormones are actually having a fight with each other in the uterus, inside the cervix, right in there, and they're having this little battle for who's going to control the tissues, and that creates the endometriosis. In that case, you want liver 2 and liver 3. Now, they can find these points, you can show them where they are, they rub these points 2 or 3 times a day, and the endometriosis will clear literally in a couple of days. The longest I've had a woman with just endometriosis, the longest she's taken to actually get rid of the endometriosis was 2 weeks. That was the longest. And people are talking about having it for 6 months. That's crazy. Well, obviously they don't know the right points to rub, do they? So it's your job to tell them. Now there's another format that you can use to eliminate endometriosis. This is really the neurotraining part of it, where we're using neurological reflexes to do the job. And it relates particularly to a physical condition where the uterus, which is sort of like a big sock, it's like just a big sock shape, and what happens is it falls backwards. No, it falls. I've got it here somewhere. A tipped uterus. Combine the effect of the smallpox. Okay, so what happens is it literally falls backwards, and then the top falls forwards. All right? It's actually. Let me see. What's the term? Is usually prolapse uterus. is the term that's normally used, right? So what happens is that instead of the uterus sitting up in its normal position, it actually falls back and the top falls down. So it actually shortens the accessible distance within the uterus. So because the top part has fallen over, and particularly when the woman has her period, she gets a lot of clotting occurring in the blood in the fallen over part. And that's where you get painful clots and dark blood and all that sort of horrible stuff. So what happens is that the top of the uterus needs to be pulled back, right? And then the rest of the process helps the suspensory ligaments to hold it up in the right place so that it stands in the right position. So instead of it falling back and squashing like this, you pull the top back up and pull it back up into its right position. That condition of the prolapse uterus, right, which is actually a posterior anterior flex action, it falls backwards and then forwards, that creates a backup of energy and pressure back along the fallopian tubes. So when the ovum comes out of the ovary, instead of going down into the fallopian tube, it floats back out into the abdomen where they have an abdominal ectopic pregnancy. If it's fertilised, if the egg is fertilised, it can get pushed back out of the ovaries, out of the fallopian tubes, into the abdomen. And they have to be operated on to take the pregnancy out of there because it won't survive and it'll stagnate and it'll become toxic and it can kill the mother. So the blood itself at the time of the period, because of the back pressure, can actually come back up out into the abdomen and create hematomas in the abdomen. Now, there's no way that you're going to get pregnant if you have that situation going on, especially if you're a woman. So this process resets the uterus, and I'll give you a demonstration of this a bit later on. But it's really important for women who have this structural problem to get this rebalanced, because they have pain on intercourse, they have clotted blood during their menstruation, they can't get pregnant, plus all of the effect that this has on the blood creates other problems for the liver and the kidneys, and so it gets more and more complicated. So I'll read through this before I give you a physical demonstration of it, and then after after we go through the other groups, I'll give you a demonstration. Then we'll check to see if there's any questions on it. So the top part of the uterus has fallen forward. It's falling down towards the pubic area. It may not be that far down. In some women it is. It's actually doubled completely, which is very uncomfortable. But it's heading down in towards that direction. So you press in and just above the pubic area in the midline, and you hold that there for 30 seconds. Now what that does is it wakes up the brain to the fact that, hey, you've got a problem in that place. So you want the brain to be paying attention, so you're just holding there for 30 seconds. The client lays face up. Obviously they've already been doing that because you've been pressing in that place for 30 seconds. You hook into the same point with the fingertips and on both hands to reinforce the contact. So you're pushing, if the lady's legs are that way and their head is this way, you're pushing in just above the pubic bone in the abdomen area, right? And you're going to push in with your fingers on both hands to get a firm grip, right? Because you're going to be working the uterus back towards the head. Right? This is a physiological problem. An anatomical problem. The anatomy has changed its position. You have to help bring it back. When it's in the right position, you can reset it. But while it's in the wrong position, it's very hard to reset. Very, very difficult. 3, have the client bring both knees up towards the abdomen, right, at the same time as you're holding. As the client straightens their legs, you firmly pull towards the head, and you do this 3 times, starting in the same position. The client touches their pubic bone with their right hand. They place their left hand on the upper right chest under the clavicle area with the fingers flat. All right, so do that again. The client touches their pubic bone with their right hand. They place their left hand on the upper right chest under the clavicle, fingers flat. All right. Then you tap L5 on 3 phases of respiration. I'll give you a demonstration of this later, so if you just pay attention to this, and if you have any questions on this, write it down, then we'll cover it in a minute. 7, keeping the client's hand on the pubic bone, they touch on the left chest under the clavicle, again, fingers flat. Tap L5 on 3 phases of breathing. 9, the client holds the pubic bone and places 4 fingers along the sternum, along the middle of the sternum. 4 fingers, right? This is for circulation. Then you tap T2, T8 and T12 on 3 phases of breathing. You've actually done this in other specific skills workshops. And if not, I'll show you how to do this in a second anyway. Now you place the endo-enoptic on the client. Remember the little enoptic thing? And I'll talk a little bit more about that in a second. Have them hold the inheritance points. You don't know what that is, do you? But I'll show you later. And as they hold these inheritance points with the enoptic on their body, you tap L5 on 3 phases of respiration. Check Food is the Best workshop. That's your allergy workshop. And then you finish off the whole process by resetting what's called the broad ligament. A broad ligament, this is a ligament that supports the uterus. You do this in a semi-sitting position. They sit up and lean back a little bit, all right? With the ankles crossed, knees bent a little bit. You put pressure on both hip bones in the front, the anterior superior iliac spine, the front hip bones, to spread the pelvis. You're going to push the pelvis apart. Well, you're not actually, but you're pushing in that direction. If you hear a crack, you've been pushing too hard. And you only do this on inspiration, and do it about 7 times. You may have to do it more if the person's really locked up in the hip area, but this will reset the broad ligament and helps it to pull up the uterus so it stands up in the right place. So write down any questions you may have with that, and I'll get back to you in question time, which will be following shortly. Then we have group 4, the ovarian function group, page 21. If you have polycystic ovaritis, that's a big word. That means you have little cysts. A cyst is like a little bubble of fluid that's on the ovary. See, the ovary has what's called Graafian follicles. That's the follicular stage. And the Graafian follicle is where the little ovum is brought to maturity. Now, the ovums and the sperm only have half the number of chromosomes that we do. Now, normally our immune system would see that and go, oh, that's a foreign thing. We have to punch that up and get that out of the system. Well, in the case of the ovaries, the Graafian follicle protects the ovum, while it's developing, from the immune system attacking it. So the Graafian follicle is like our first mother. Right? It's taking care of the ovum while it's developing in the ovary. But at some point, the ovum is supposed to be pushed out from the Graafian follicle into the unknown to find the fallopian tube to go down and get fertilized. Well, sometimes it doesn't break open and it just fills up with fluid, and that's called an ovarian cyst. And they can get so large they can be bigger than the ovaries. But the trouble is that they can cause inflammation in the ovaries and in the surrounding areas, and they can be quite painful. So quite often people who have this will be diagnosed professionally with this condition, and they will tell you, oh, I've got, polycystic ovaritis. Oh, okay, right, good, fine. And you go to these points, yin tang, the ear notch, spleen 6, zigong, central vessel 3, 4, 6, and stomach 40. You do your magic, and the cysts will break. The cysts will break. They will just dissipate. The water will get resorbed. That's fine, unless there's infection in the cysts, in which case sometimes it doesn't make any difference, sometimes it does, but you can just keep balancing them with the same points. It's going to clean up the whole area. And literally within hours, the pressure and the pain is gone. Sometimes faster, sometimes longer, but it really doesn't take long to clear up the polycystic inflammation problem. If they have ovarian failure, and this is often what the people who are doing in vitro fertilisation will tell you, I have ovarian failure. That means it's not producing the ovum. Well, you've got a whole heap of really nice points here in this order to wake up the ovaries to make the ovum again. And it works very good. There's another little set of points there, spleen 6 and stomach 36, which quite often are good as homework for people who have ovarian failure. Give them the spleen 6 and the stomach 36 as homework. It tends to continue the effect of the previous group. Sometimes there's a blood stagnation or a lack of circulation to the ovaries, and so you can stimulate the blood supply with that recipe there of spleen 8, spleen 10, zigong, and yipeng, in that order. The pelvic inflammation we've touched on before, but here is another recipe for pelvic inflammation. It's quite a long one, but it's a very powerful one, particularly if a person has had reoccurring infections, pelvic infections, non-specific urethritis, all of those type of infectious things in the abdominal area that have been going on for a long time. You want to use these points. The pelvic inflammation is a very general term, and it covers a lot of things. And these points, even though there's a lot more points, will actually cover just about all of those things. I've actually given the pelvic inflammation points as a tonic formula for women who have had recurring infections and so on, for yeast infections, for urethritis infections, for vaginal infections. It does really, really well. So it's a very, very good group for pelvic inflammation. Anything to do with infection, inflammation in the pelvic area, for men or women. Then the last group is for male fertility, and you have a recipe there for deformed sperm. That means they have 2 tails, short tails, 2 heads, funny heads. They're just... Actually, I'm not sure if we've got any on the front. But the sperm really does have a very specific shape. No, looks like that's a perfect male there. Don't have any deformed sperms there for you to look at. Oh well, never mind. So anyway, anything other than what you see on the front is a deformity, and it probably, because of that deformity, means it's genetically not sound. It's not going to work. Even if it actually can break through into the ovum, because of the genetic deformity, it won't continue. It'll just stop, it'll get broken down, reabsorbed, and wait for the next time. If the man has back pain, or they feel cold, or they have a poor or weak erection, right? It takes them a week to get an erection. Sorry. Then you can use this recipe. Kidney 7, spleen 6, stomach 36, bladder 23, bladder 52, governing vessel 4, CV4 and CV6, in that order. And it really works. Back pain and they feel weak. All right, the back pain is usually, that same thing we were talking about before, is that weakness across the back. Sometimes they describe it as my back is going to break. They feel like if they lifted anything, their back would snap. But also they feel weak. Right? They're weak internally. They just don't feel like they can do any more. Then you've got bladder 23, bladder 52, spleen 6, CV3, CV4, kidney 3 and kidney 7. And that's another alternative to the one above, because the weakness may show in a short-term erection. They tend to run out of energy fast. So either one of those could be changeable, but if they feel cold, then you would use the first one, most definitely. If they have very high stress levels, they're really under a lot of pressure, they've got to make a lot of sales by the end of the week, or, there's a lot of pressure from home or from finance or from society in some way, or they have pain in the testes. Now, it doesn't have to be pain that exists all by itself. You can have them actually, feel their testicles, and if they feel painful, then this could still apply. Now, obviously, they shouldn't be squeezing their testicles because, yes, that's going to be painful, right? But let them do it, right? Because they know when to stop. So if they're, highly stressed or they have painful testes, sometimes, they'll sit down and sit on one of them and go, oh, damn. And if the pain doesn't go away, then again, this recipe, all right? Sometimes this has worked also in young boys whose testicles have not distended, they haven't dropped. So they're still up in the abdomen. And using these points have actually helped the testes to drop down to a normal position. Then where the man has urination problems, this could be related to prostate. Abdominal pain, usually lower abdominal pain. And they have phlegm, they have mucus in the throat. They're always trying to clear their throat. Right? That sort of phlegm thing all the time. Then spleen 6, spleen 9, spleen 10, large intestine 11, stomach 36. Another possibility for that could be CV12 and bladder 40. Sometimes it's both. So if they do the first recipe and it's not enough, get them just to add the other 2 points to it. Let's see if that works. So there are your 6 phases or your 6 groups of possibilities. You don't have to go through all of them. A lot of these are there simply because women are going to have these types of problems, and if they do, that's going to stop them from becoming fertile, conceiving. Okay, so I want to go through with you through the endometriosis process. It's actually made up of about 3 or 4 different sections. So I'm going to run through all of this process, and then afterwards we can organise any question times. The main advantage of this is, of course, where the uterus has dropped backwards and then the top of it drops forwards. So to start with, you've actually got to bring the top of the uterus back up again. All right? When the uterus is up, then you can stabilise it much better. All right? Now, if you want to, come around and have a look a bit closer, you're welcome. Just don't stand in front of the cameras, unless you want to pay royalties or something. So if you want to stand behind there or behind the sides here, not a problem. Firstly, you locate the pubic bone. Now, the pubic bone is not found by coming in this direction. It's found by coming in this direction. Right? Now, you can do the same process with men, but this is for the prostate in that case. Men can have prolapse bladders and prostate, and you can use exactly the same process to rebalance the prostate and the bladder. exactly the same. So you find where the pubic bone is, and you come just like 25 mil further up from the pubic bone. You have a double finger grip in this position, right? And you start by holding this place for about 30 seconds. This tends to wake up the brain's attention to what's going on in the area. You could do it without holding for 30 seconds, but you won't get as good a response. All right? So, as you can see from point 1 there, make sure that you hold this point for at least 30 seconds. If you hold it longer, that's okay. It's probably just not necessary to do it more than 30 seconds. So then you take a double grip, as I said, the fingers literally pulling into the abdomen, so you're making a hook with your fingers. You're hooking the top of the uterus, in fact. So you get in there, in the same place that you were holding for 30 seconds, and you hook in a little bit. Right? So then the person brings their knees up. All right? Right? You haven't done anything different except hook into the abdomen. Now what's going to happen is, as she breathes out, she's going to straighten her legs. As she breathes out, she straightens her legs, and I pull towards the head. So take a big breath in, straighten your legs slowly, and I'm pulling towards the top of her head. Great. Good. And do the same thing again. You relax the pressure, hook in again, she straightens her leg, breathes out, and I'm pulling towards the top of her head. Right, relax, breathe in, legs up, and straighten your legs as you breathe out. Okay, now that's the anatomical part of this process, where you're literally pulling the anatomy of the uterus head back up as far as it will go. Now, in really, really chronic situations, this won't happen first time. You won't get it in the right position in the first time. You may have to repeat this 3 or even 4 times until the uterus gets the idea that it can go back to its normal position. But that's what you're doing, is actually pulling the tip of the uterus back up. And because of the structure of the uterus in many women, that would just automatically now fill out back into the right position. But for usually older people, maybe that doesn't happen so well, and you might have to repeat the process a few times. So that takes us down to point 5, the end of point 5. No, point 4. Now, the person touches their pubic bone with their right hand. All right? There's a reason for this. The other hand is touching on the right side, just under the clavicle. Fingers flat, but not touching anywhere else. Just fingers on the chest. Right? Flat of the fingers, not the points, flat. They hold that for, a few seconds. 30 seconds is good, 60 seconds is probably too much. But what that does is it activates any emotional responses to what's been happening in the uterus area. That now sets up the brain to pay attention to what's going on in the area. Well, that's what we want it to do. But now it's starting to recognise that there are certain imbalances happening that it wasn't recognising before. So the next step you'll see is now to tap on L5 on the 3 phases of respiration. So keep holding, and we sit her up. All right. Now L5 is the lowest lumbar vertebra. It's just above the sacrum. All right. So I'm going to tap these points. Now she breathes in, and she breathes out. Great. Now she keeps her hand on the pubic bone, same hand, but now the top hand goes to the other side. Again, flat, no fingers, no palm, no arms, just the fingers. Leave that there for 20, 30 seconds, just to get the brain to pay attention to other emotional or attitudinal responses to what's going on in the uterus area. Then we sit her up again. All right. And we do the same as before. Tapping, then breathe in and breathe out. Good. And down. Now, whatever the brain was paying attention to before is now reset. The tapping of the L5 has reset the emotional relationships not only to the uterus but also to the lungs. Because we tend to hold a lot of emotional reactions in the lungs, particularly in the upper part of the lungs. That's why we don't breathe high. We tend to breathe more lower in the lungs because we can store emotions in various parts of the lungs that we don't know how to deal with. So we're just reminding the brain that maybe there's some emotions caught in the lungs that are still influencing how the uterus is functioning. So then, after having done that, we have the person now touching the pubic bone with the right hand and 4 fingers now placed along the sternum. 4 fingers directly along the sternum. Now, this is a challenge to the circulation process. It's just a little bit wider apart. They're not closed, they're just a little bit wide. So that this now challenges the relationship of the circulation to the uterine area. In fact, all of the reproductive areas, reproductive organs. The person holds that again for about 30 seconds or so. Breathing and thinking nice things about the universe and all that. Or not. So then we sit her up. Now she can continue to hold those points while you do the tapping. You see that now on point 10 we start with tapping T2. Right? So if you come down the base of the neck, the first big bump that you feel is cervical 7. Then the next bump is T1, and the next one under that is T2. All right, so T2 is the first one that we tap. Big breath in and out. Good. Now we go from T2 to the next point, which is T8. You can find T8 by going from the base of the scapula, and one down from there is T8. We tap as before. Big breath in. Big breath out. Good. And then the next point is T12, which is where the last rib attaching to a vertebra comes in. So we've got 8, 9, 10, 11, 12 is about here. Tapping. Big breath in. Big breath out. Good. And down you go. Now what we've done is we've reset the anatomical position of the uterus. We've checked for stored emotional relationships. We've reset the circulation to the reproductive system. Really, there's very little left now to make sure that the uterus is going to stay in place. But the uterus is where we make babies. Where a woman starts to make babies, it reminds her of when she was made. Right? Which reminded her mother of when she was made, which reminded her mother, and so on. So there's really a lot of inherited factors attached to the uterus and how it functions. So to make sure that we catch any of those inherited possibilities, the next steps will follow in this order. So we have, could someone pass me the Enoptic over there, please? The one, yep, that's it, good. Thank you very much. That was our security guard friend. So we put the Enoptic on the person. Now you can put it over the belly button if you like. It actually doesn't make a lot of difference for this. So we just put it on the person. That's going to now challenge a lot of inherited stuff. You can take your hands off now. It's going to challenge inherited stuff, specifically suppressed diseases that could lead to inherited uterine weaknesses. These inherited factors are what makes the endometriosis and the infertility come back and come back and come back and come back. And that's why the no endo Enoptic is such a valuable tool at this point, because it can challenge the history, not only of the individual, but their family history and anything that may be influencing how the uterus is working. Plus the other reproductive organs as well. It's not just for uterus. That's why I say, and although this is really good for women, when we get the Enoptic made for the men, for the prostate imbalances, you could use the prostate Enoptic for men with the same process. But luckily we have the no endo one here. So you place that on the client. Now you have them hold the inheritance points. Now the inheritance points are, one point is the umbilicus itself, and that's one of the reasons why you can't really put this on the umbilicus. So one thumb in the belly button, put your thumb in your belly button. You can just press it, right? And then 2 fingers below and either side. Right? So 1 thumb in the belly button, 2 fingers below and either side, around about 50 mil apart, and about 25 mil below. So 25 mil down from the umbilicus and 50 apart, 25 on each side, and they hold that. They keep holding that while you do the last section, which is tap L5 on the 3 phases of respiration. So she can hold the Enoptic in place, that doesn't have any effect. Sit up, she keeps holding the inheritance points as we tap again L5. Big breath in and big breath out. Great. Good. Then she can let go of that. You can take your Enoptic back, put it in your pocket, whatever you do with it. It's at this point that you want to investigate to see if there are any allergies that may be related to the uterus. Now, because of what you've done, the focus of the attention in the mind is on the uterus. So you could actually now ask the person what they're allergic to, right? Just get them to think about having those foods, put the foods on there if you have them available, and hold them there while you do the last section, which is the broad ligament. The broad ligament section is a little bit more of a structural last step, because in the process of the uterus falling forward, the ligaments that hold it up normally have relaxed too much. So we have to, now that we've got the uterus at least attempting to come back to its normal position, we want to tighten up those ligaments. Well, in fact, they don't hang from the top, it's suspended from the side. It's like this. So that suspension process is called a broad ligament, and it goes across the pelvic bones. So to do this, I think what we'll do is I'll get you to sit up and turn around. Sit up and face this way. Face around, turn, more. Good. So she sits, ankles a little bit crossed. No, keep your knees up, cross your ankles. Legs, good. That means spreading your legs a little bit. Good. Now, I'm going to do this from behind, but normally you would do this from the front, so you can see, is just hold the front of the hip bones, and you're going to be pushing them so that they're spreading apart. You're spreading them this way. Yep, that's it. So, and this is on inspiration only. Take a big breath in. I'm pulling and relax. Big breath in and relax. Big breath in and relax. That's 3. Big breath in. 4. Again. Again. 6. And 7. Right. You can relax. That's the last part of resetting that uterus. All right, so you're pulling the hip bones in the front, you're pulling them back and out. Like you're trying to spread them out behind you. Now what that does is it actually reduces the distance from either end of the ligament. And it helps the ligament to reset its own tension. And in doing that, it sticks the uterus in the right place. And it's really the last thing you need to do. Some practices use this as the first thing to resetting the position of the uterus. It will never last. There are emotional factors, there are circulation factors, there is the actual physical position of the uterus in the first place. So the ligament is actually the last thing to be done. It's also related possibly to hypoadrenia. That is low adrenaline. Because when a person is hypoadrenic, they are also not producing enough minerals from the adrenal glands to maintain the integrity of the ligaments. Because that's how ligaments get better, is because of the mineral corticoids that we produce in the adrenal glands. Well, hypoadrenics don't do that. They don't have enough energy to do that. So the ligaments then become weakened. So where a woman has problems with this uterus tilting and creating all these symptoms, you also want to, take them through Feed the Glands workshop, which is how to reset the adrenal system. Very nice combination. Okay. Okay. Thanks, Stephania. It's great. Good on you. Okay. So, look, I just wanted to mention a few things about the enoptics. Particularly in this case, we're using the no endo enoptics. These are the little optic fibres that I referred to before that hold various frequencies. A few people have asked me some questions about these, like how does it work? What's inside of it? Can I eat it for breakfast? No. All right, so how this works is that we have a medium, a substance, an optic fibre or a slice of optic fibre that has certain qualities that means that it can hold energetic patterns in it very easily. So what we do is we take the little optic fibre and we laminate it in this plastic and we send that off to a computer. Well, we send it off to a man who runs the computer. And so he sets up the different formulas that we want to go into the enoptic. And the computer then plugs in all of the vibrations that are supposed to be put into that enoptic at one time. It's done over a few minutes and it literally impregnates those frequencies into the optic fibre. Now you could do this with other things. You could do it with oils. You could do it with little sugar of milk pills. You could do it with water and alcohol. You could do it with some forms of plastic. But we've found that the optic fibre holds these frequencies better than any other medium. And it holds them longer. So we can actually put in hundreds and hundreds and hundreds of different frequencies into one optic fibre where you can't do that with other medium. So how that works is that our subconscious is very, very aware of what energetic influences are happening to us. So if I put this on my body, my subconscious is measuring the fact that these frequencies are connecting to me. My subconscious is already playing with that and is starting to recognize that it's not natural. These are all artificially made. They're made by a computer. Right? So because they're artificial, the subconscious says, no, we have to get that out. Now, you think about it. We have a certain type of frequency that is an abnormal frequency. If that was able to stay in your body, it would produce various types of imbalances. In our reaction to those frequencies, we react in a certain way to eliminate that type of frequency. Our reaction makes us better. It makes us stronger and helps us to be able to resist anything that would create the same imbalances in us that this frequency could. I'll say it a different way. If we had a certain set of imbalances, all right, made because we're stressed, and the frequencies in this, right, in a normal person would make the same types of imbalances, then if we put this on a person who's stressed, their reaction to this would also change their reaction to the stress and would eliminate their symptoms that they make from their stress reactions. So it's a really good way of challenging not only the person to create new ways of responding to things in nature, which protects them against those things, but it's also a way of challenging what's inside the person to help them to overcome their own creation. But because this is foreign, they don't know what this is, they will actually respond to this in preference to their own imbalances. Isn't that amazing? So you can actually trick a person into getting better by giving them one of these things to put on, and they react to this, and in reacting to this, they fix up their other problems. Isn't that cute? So that's why we do it. Well, they don't have to have a problem, right, to get the advantage of it, because we can put the frequencies here and we can then do other techniques like rubbing the points, like we did with the endometriosis process, for example, and that then helps their nervous system to recognize these types of frequencies in them and changes how the nervous system responds to those frequencies. So when the combination of enoptics with neurotraining is really, really quite remarkable. It multiplies the options that are available to the person's nervous system and to their energy. So we're sort of training the nervous system, but we're challenging the energetic system. Right? And that challenge means they're going to respond in a certain way. The neurotraining helps them to respond completely so they get the full benefit from using these things. Okay? So that's sort of how it works. Well, that is how it works. And it's based on the principle of action, reaction. We put this on the person, it creates the action. The reaction is very specific to this frequency, whatever it is. And that reaction is what trains the person's energy to respond differently, to become stronger. So you can use these to build up your immune system, you can use these to build up your circulation, your thinking, your nervous system, your bank balance, anything. Yes, it's true. You can actually use these things to challenge the whole concept of poverty in you. How many people here want to be poor? How many people here want to be rich? And the other people already are rich and they don't care. Okay then. I'll talk to you later. So yes, there are frequencies that we can use, right, that in your response to the frequencies, your subconscious learns how to make money, or to be wealthy, or to be happy, or to be healthy, or to be whatever it is. So you're not telling a person what they have to do. They're responding in a way that is what they have to do. They don't even have to know what's in these things. The response is what does the change, not these. These are the challenge. The change for us comes in our response to them. Okay? So we have lots of different enoptics, and as I said before, we'll give you a list of what's available, and we'll be increasing the list. And if you have specific things that you want to overcome in your life, let us know, because we may be able to make an synoptic to help you to do that. Right? So, if you have any of those things, any of those possibilities, let us know, and we can write down on the list for further or future synoptics to be made. Okay, thanks a lot. Okay, so do you have any questions now on any of the groups, either the point orders or what they're working on, or how to apply it, or what's the meaning of the universe or something? All right, the question is, can you use different recipes of points separately to each other? Yes, you can. In saying that, I wouldn't do one recipe, then immediately another one, and immediately another one, and immediately another one, because that's going to confuse a lot of the response. Remember that rubbing these points in this order is to achieve a certain response. And you want to give the person the ability to make the response and to finish that response. Now, that could take a few minutes, it could take a couple of hours. So yes, you could use any of these recipes on the same day, but within reason. Okay, if they seem to be related to the issues, and they're like, you're just adding on a couple of points because it's already listed as a possibility, then you could do that straight away. But if you were going to do a different recipe on the person, I'd wait at least half an hour. An hour would be better. If the person has lots of energy, lots of vitality, then you could do that in probably 20 minutes. But the people who are going to come to you to get this done usually don't have much vitality to start with. So you'd probably be able to get away with maybe one, maybe two of these, but you'd have to be working on their energy levels anyway. So yes, it's possible to use different recipes, but use your common sense. If the person's got tons of energy, you could probably do 3 or even 4 of these in a day, and they'd get a lot of benefit from it. But it's also going to use up a lot of their energy as well, so they're going to have a downtime as a consequence. So really the best idea, and this is a principle that comes from homeopathy, is that you want to get the greatest effect with the least influence. So if you do one recipe and it has a really great effect, you don't want to upset that by putting in another one. Right? Because the long-term benefit for the person is just that. It's a long-term benefit. But if you start overlapping the effect with other recipes too soon, you might be slowing down and shortening that to a not so long term. So it's possible, and again, you would not go through all of these recipes at the same day. It wouldn't be necessary. If you have a look at these and you match these with how your system operates, already by going through the groups, you've got a pretty good idea of which ones suit you and which ones don't. And if you're not sure, just do the general ones. Just do one in a day and see if that helps. If it doesn't, great. Do the other general the next day. Play with them, experiment. Now, for example, it says, this is under endometriosis for fibroids, and you don't have fibroids, but you think, maybe you might have some endometriosis. Okay, use the points, see if it helps. The thing is that if you use these points and they're not relative to you, you're not going to do any damage. It's not going to hurt. So, have fun, experiment, but don't overdo it. Yeah. Other questions? Rosa again. Rosa has all the other... Has everybody been telling Rosa to ask these questions? Yeah, I know. I see what's going on. Okay. What's the optimum number of times a person should do this if it really relates to what they have? If a person knows they have pelvic inflammation and they want to use the recipe for pelvic inflammation, then initially, while they have that inflammation, they could do that more often. So on the first day, they could do it 3 times. But on the second day, twice. On the third day, once. And if they are still concerned, then they could do it once a day for the next, week or so. But when something is acute, you could do it more often because the energy gets used up faster. But as it tends to settle down, you want to do these recipes further and further apart. All right? They are a training, but they're it's unnecessary to do them too often if there is not an acute need. What happens is you go from the acute to a chronic or a long-term imbalance, and then what happens is you use this as a prophylactic against the problem happening again. So you don't need prophylactics very often, maybe once a month. So after having done the recipes that you find work well for you, you could do them for like once or twice a week for 90 days, for 3 months. That will build them in and will give you prophylactic protection against that imbalance coming back again. All right? It'll get rid of the acute, it'll take care of the constitutional stuff, and it will also build a nervous system to protect you against that happening again in the future. All right? So that would be ideal. If the person really has the inflammation, you could do that more often initially, but I wouldn't do that for more than 3 days. Yeah, so the question was, where do you put myomas? Where do you put myomas? The question should have been, is a myoma in the uterus the same as a fibroid? Yes, it is. Interesting. The question here is, if you've had a hysterectomy, how can you have endometriosis? Well, most people only have endometriosis in the endometrium, which is part of the uterus, and in a full hysterectomy, the uterus and the ovaries and everything is all taken away. But what happens, remember I said where the uterus falls over and it creates a back pressure? When the woman goes through the normal cycle of changing the cells in the uterus that should be washed away with the blood, it doesn't get washed away, it gets back pressured back up into the abdomen. And the little cells of the endometrium that are in the abdomen become inflamed and they have what's called abdominal endometriosis, even if they don't have a uterus. Because it's the little cells from the skin of the inside of the uterus that have gone up through the fallopian tubes into the abdomen, and they can become and create the inflammation. They respond to the hormones as if the uterus was, just the same way. But of course, they still have the endometriosis problem, the inflammation attached to them, and they start to inflame the abdominal wall. Now, there's a really good homeopathic preparation that you can use for that, and it's called pulsatilla. Pulsatilla, and you want to use that at a 200C potency. It works brilliantly for abdominal endometriosis. It's also a specific for pancreatitis. But we could go on forever talking about that stuff. But pulsatilla is what you'd use for abdominal endometriosis, even if the woman doesn't have a uterus anymore. And it sounds strange, but women can have endometriosis without having a uterus. Yeah, good question. Is it that a woman has endometriosis only because the uterus is tipped forward? No. A woman can have endometriosis without the uterus tipping forward, and the point recipes will take care of that without having to go through the procedure for endometriosis. But if the points don't get rid of it completely, and even if the woman knows that she has endometriosis, it doesn't hurt to go through the neurological procedure for endometriosis anyway. Because then you've got the recipes taking care of the energetic side, and you have the neurological stuff taking care of maybe if it's anatomically in the wrong position, even if it's not anatomically in the wrong position, women can still have endometriosis, but the recipe points are going to take care of that very easily. Let me paraphrase that. Is the question then, because you have the enoptics, does that replace the use of the medication? Or does that make the medication unnecessary? This is really politically dangerous ground because unless you are qualified, you cannot tell a person to stop taking the medications, no matter what it's for. All that we can do is use the enoptics, use the balancing processes, use the techniques and so on, and remind them that if they get better from that, they don't have to keep taking their medications, and they should go to their doctor to confirm that. If you're better, if you don't have the problem, why would you take a medication for it? Well, you can't tell them to stop taking it, but you can say, look, it seems to me like you don't have the symptoms, seems to you like you don't have the symptoms, why don't you go back to your doctor and say, I want to stop taking this medication? And see what he says. Get his or her opinion. Involve them in the process. Make them feel like they've contributed because they're human, they want to do their job, they want to help. Unfortunately, they don't have or won't allow themselves to have everything that will help. So if we help them and their clients to recuperate, because that's what we do, we help people to recuperate, then they can go back to their doctor and say, look, I've recuperated really well with the aid of some neurotraining. Now I don't think I have the symptoms. What do you think? And they're going to say, 9 times out of 10, you don't have the symptoms, the medication worked really well, you don't have to take it anymore. Because you didn't make the neurotraining in opposition to, you made it an assistant to, which is really what it does. It helps people to recuperate. So you tell them to go back to their doctor and say, look, I've recuperated really well with the aid of some neurotraining. Chances are the doctor won't even know what that is, but it's a nice name, so they accept it. And then the focus goes straight back to, the medication. What about the medication? Well, I haven't got the symptoms anymore, so I don't think I need it. Oh, okay, well, we'll try you for a week not having it and we'll see what happens. And of course, nothing happens and then they never have to go back on their medications. All right? So you really need to be politically aware of what you say and how you present neurotraining to your clients and how they can present it to their doctors or their consultants or gynecologists or whoever else they're working with. Look, I've had big fights with doctors, with naturopaths, with homeopaths. I've had fights with just about everybody because a client gets better and they go back and say, your stuff didn't work, I think you're a load of rubbish and I'm going back to Andrew to have some more neurotraining. No, that's really not what you want them to do. You want them to get better and you want them to become living proof to these other people that there are other ways that can help them to achieve what they're trying to achieve. Stay within the model of recuperation. It's the safest place in the world. We help people to recuperate from their medications, from their divorce, from their disease, from their car accident, from their stress. Doesn't matter what it is, we're helping them to recuperate from those things. Now, if they get it in their head and they go back to their doctor and say, I've recuperated, I'm better, I did some neurotraining and I feel really great, the doctor is more likely to accept that rather than the client going to the doctor and saying, you're a quack, you don't know what you're talking about because you didn't fix me and neurotraining did. That's an education process and you have to educate your clients to understand that all you're doing is helping them to recuperate. It doesn't matter what you know. What's important is they get the idea that you helped them to recuperate. Then they will tell the same thing to other people. Well, that's great because there is nobody else in that niche. We are the only people in that area of recuperation. Use it, expand on it, make it completely ours. So anybody who wants to have any sort of recuperation is going to think, neurotraining. I need to recuperate from that. Oh, neurotraining. That's where this is going to go on forever and ever and ever. Doctors accept it, psychologists accept it, the clients accept it, even politicians are accepting it. Right? So get it in your head that all you do is help people recuperate, and they will get that in their head as well. That's going to take this a long, long way. Do I have any problems, in actually identifying disease names and stuff and putting it in the book? No, I don't, because they're going to tell you that. This is life tool stuff. You're teaching this to people so they can help themselves. They know what they've got because they've already had it diagnosed somewhere. If you were diagnosing, that would be a no-no. You don't do any diagnosis with this or any of the workshops we do in neurotraining. But they're going to come into a workshop and say, oh, endometriosis, that's great, I've got that. They're happy. They know they've got a problem, but they didn't know that this was going to be the solution. Or you could go to an endometriosis club, and I'm sure there must be one somewhere because they're all women, and you can say, hey, come along and do this workshop. One of the things that we can balance, or that you can balance for yourself, stated even better, is some recuperation from endometriosis. Now, some of them will go, yay, and the organiser will go, no. Because the organisers know that if everybody gets fixed, they don't have an organisation anymore. They have no reason to have an endometriosis club. So they're going to oppose it. But the people who are in there will say, wow, that's really great, that's exactly what I need. So no, I don't have any problems. And in fact, there's a whole list of other, related issues that we could have put in here that I didn't because they're not specifically related to fertility. But things that are specifically related to fertility, I have no problems putting in here because people already know that. Now, there are some other things related to fertility that are not in here, like alcohol, right? Because we can't do much about the alcohol in terms of a specific skill, apart from education. You can tell people, alcohol is bad for you, it's bad for your fertility, and it's even worse if you get pregnant. Right? It's like the alcohol really messes up the whole process. It's called the fetal alcohol syndrome. Well, send them off to the websites and Google to get them educated on that. But, we don't have a specific skill to take care of that specifically. So there are lots of other things that we could be talking about and we're not, because we're dealing with what we know how to do in helping a person to recuperate from what they already know they have. And even if they don't know what it is, great. There's stuff in here that will help them anyway. So, yeah, I wouldn't worry too much about using the terms, but I would never diagnose anybody with that because the terms are in the book. Just because they respond to a certain recipe does not mean that they have anything named relative to that group. It doesn't prove anything. Right? It's just a guide, that's all. Some good questions. Any more good questions? Rose has been thinking of a good question. That's a good point, and it's something that I forgot to mention before. Can you go through all of the 62 points, and if you did, what effect would that have? I know of one woman that did this, and her name is Superwoman. Going through all of these points is going to take care of a lot of imbalances. And people who would do this on a regular basis would become very, very powerful in themselves. Powerful as women and powerful as men. Now, there were some comments and some questions before about using this in conjunction with increased sexual energy. Because increased sexual energy isn't just for sex, it's for building up the energy and being able to direct that energy to create things. Well, if you add the power of this to the creativity of increased sexual energy, who knows what could happen? But I'm sure some very big things would happen from that. Just think about combining different workshops and see what happens. This is a brand new area and this approach has never been done before. So I don't want to get into the diagnostic model of, well, if you do this and you do that, that's going to happen. Well, I'll do that in a very general sense, but it would not be a diagnostic thing, right? Because everybody's going to have a different response. So try it out and see. Do all the 62 points, 30 seconds each, right? And then do increased sexual energy and tell me what happens. Is the pelvic inflammation recipe also good for candida? Yes, because the candida is not candida, it's candidiasis. That is the inflammation that comes from the overgrowth of candida. Now, in women, they can get the yeast growing in the uterus or vagina, actually. And so that's what's creating the inflammation. Now, if they've had that for a long time, they'll have to do the pelvic inflammation recipe to reduce the inflammation in the whole of the pelvic area. That also may be enough to remove the problem with the yeast. It may be. I don't know, because there are lots of different influencing factors around the yeast. The vaginal thrush, or the yeast infections that women get, always relate to relationships things. There's something going on in the relationship that is acute, that is out of balance, and they need to get sorted out. And when they get that sorted out, the recipe for pelvic inflammation could be one of the recipes that will help them. Certainly if they have developed pain and sensitivity in the abdominal region because of that, yes, this will work very well. So the question is there a problem in using the forbidden points for pregnancy where she may be pregnant but she doesn't know that she is yet? Another good question. I like good questions. The thing to do is to ask the person, when was their last period? If their last period is more than a normal cycle, then stay away from large intestine 4 and spleen 6. But they don't actually really become a problem until towards the end of the first trimester. Because what they do, or what they can do, is create contractions in the uterus. Right? Now, that contraction can be very small, but it can be enough to loosen off an embedding, fertilized egg and have it wash away later on. So obviously you don't want that to happen. So just ask them when they had their last period, and if they've had their last period longer than the normal cycle, then just stay away from those points. If they're really, really newly pregnant, being so small, even if you did use those points, it probably wouldn't have a problem. They probably wouldn't have any effect on the fertilizer. It might not even be embedded at that stage. It could still be just floating around in the fallopian tube, or finding its way through the uterus. That fertilised little egg can wander around for actually, a number of days before it, finds its right spot. So in that case, the person has just as much chance of losing that pregnancy by sneezing as by rubbing those points. So, it's not a really big problem. But if they haven't had their period, normally they were expecting it last week, you think, the possibility is they're not going to have a period because they're pregnant, so I'll just stay away from large intestine 4 and spleen 3. If you have muscle monitoring, you can check that anyway, of course. The question is, do you do the master point group number 1, before you do the balancing for the endometriosis? Yes. Use the master points before doing anything else in the manual. How long do we have to do the endometriosis procedure before we see it getting better and so on? If you know that you have endometriosis, and usually women know this because they'll come to you because of it, the gynecologist or doctor has told them that they've got it. If they've just been told a couple of days ago that they have it, send them home. Tell them to come back 2 weeks later, right, with a confirmation that they have it. Because often they say they have it, and yes, they had it at the time, but a few days later they don't. It really is a big problem, because people are being diagnosed as having endometriosis very, very often, and it's unnecessary because they'll get over it themselves. So I usually just send them back to come back, or tell them to come back a few weeks later with a confirmation that they have it. That means they go back and get it checked a second time. If they still have it, great, then you can work on them. And if they did these processes on endometriosis in 3 days in a row, within 2 weeks, actually within about 10 days, then they shouldn't have any sign of endometriosis. That's the average. There's going to be exceptions. Other people will do it in less time, some people will do it in more, but the average is about 10 days. And that's if they've had it for an extended period of time. If they've had it for more than 6 months, they'll probably have it for about 10 days or so. If they've had it for less, then they'll probably get rid of it faster. It really doesn't take long, to change these symptoms when a person has the right energetic pattern to live in. It doesn't take long at all. In fact, one woman in Australia who did this process, the next day went to a gynecologist and he says, well, what happened? Right? He said, by the looks of things, everything is fine. He took, little samples that they do. He sent it off. There was no endometriosis at all. That was 1 day later. So that's good. What's the effect of using this recipe on the fibroids? This is not a recipe for the fibroids. All right? Listen. It's good to me. Listen. The recipe for the fibroids is not working on the fibroids. It's working on the endometriosis that's come from the aggravation of having the fibroids. Okay, now in some people it has an effect on the fibroids, but that's more an accident than by design. There are other things that you can do for the fibroids that are not related to this recipe. You're actually still working on the endometriosis, but it's because the fibroids that are in there are aggravating the tissue, and that's what's leading to the continuous endometriosis. Okay?